Well on time. Our next speaker is Dr. Rahul Prasad. He'll be talking about the electrodes on our.
Very good morning, sir. And at the onset, I would like to thank the AIOS Scientific Committee for giving us the opportunity to present our instruction course on ERG. Thank you, sir, Vibhuti sir, for giving us a splendid introduction to what ERG means and the components of ERG. My job today is to give an understanding of what machines that we use and the electrodes that are used for ERG. So to record in ERG, we must have an understanding of its basic technology that has to be used and the clinical protocol to be followed. The basic technology includes information about the electrode, what happens when the eye is stimulated by the light, and finally electronic recording devices which record the impulses. The clinical protocol includes how to prepare the patient, the IC standard for the ERG, and finally the analysis and the reporting of the ERG. Coming to the first part, that is the electrodes. Now there are three types of electrodes that are used in ERG. They are the active, reference, and the ground electrode. The stability of these electrodes are maintained by a good connection. Now good connection also causes a decrease in the impedance, and less of impedance would mean less noise. And if the impedance is more, that leads to a wrong reading. Now, the cleanliness has to be done, has to be preserved for the electrode because it avoids infection and also it decreases the impedance. For a good recording by an active electrode, we have to ensure a use of a non-irritating, non-allergenic, ionic, conductive, and a relative non-viscous solution. It should have a very good ocular contact to ensure proper electrode impedance, and we should define both normal values and variability for our own laboratories. Now, the different types of electrode that we can use are, the active electrode that we can use are the conductive fibers, foils, conjunctival loop electrodes, and the contact lens electrode. The contact lens electrode are centrally transparent with an optical opening, just works like a lid speculum. It gives the best recording, and the recording is stable even with the highest amplitude. The types of electrode include the skin electrode. They are mainly used in children. The corneal ERG electrode, which can be monopolar or bipolar. The DTL electrodes that are the most commonly used electrode, and the gold foil electrodes. The second type is the reference electrodes. Now they are incorporated into a contact lens speculum assembly where you can, when you are using a bipolar electrode, such as the Burian electrode for stable configuration electrically. These electrodes can be placed near the orbital rim or the ear lobe or even on the forehead. The third type of electrode that are used in ERG are the ground electrodes. They are a separate screen electrode which are attached to an indifferent point and are connected to the ground. Typical location for attachment of these electrodes are either forehead or near the ear. Now, understanding what actual electrical impulse is captured. So there are two letters, A and R. The A represents the capture action potential that is captured by the active electrode, which constitutes of both the actual action potential and the impedance. The R constitutes the impedance that is captured by the reference electrode. Now, if we subtract, then we get the actual electrical impulse. Now coming to some specific types of electrode. The first is the jet electrodes, ERG jet electrodes. These are disposable monopolar contact lens electrode, gold foil electrode or polymethylcrate with lead wires. It has got an ease of insertion. However, movement of lens during recording and absence of lid speculum can contribute to the variability of the recording. It reduces the possibility of eye infection. The disadvantage is the gold plate etches off with time. The second variety is the Burian Allen electrode. These are bipolar, reusable contact lens electrode with a built-in speculum and lead wire. It is customizable to various sizes, ideal for testing infants. The reference electrodes are built into the electrodes. The PMA shows variable degree of blurring, so not suitable for recording pattern ERG where the image clarity is vital. They are basically used for full field ERG, but remember, they are very costly in nature. The most commonly used is the DTL plus microconductive thread electrode. These are conductive threads, almost 50 microns, floats on the corneal film surface. It has got a negligible mass, low cost, and is disposable, convenient to use, and it gives a very clear image. There's no interference with pupil or optics. It gives a very reliable ERG reading, and is very well tolerated by the children. Then is the gold foil electrode, which are useful when we can't use a contact lens electrode or when you don't want to anesthetize the cornea. The ERG amplitude will be substantially affected by these electrodes, and it requires an adapter. Now the color coding, if we just see the adapter wires and the electrode wires are, the active electrode are usually red in color, the reference electrode are usually blue in color, and the ground electrode are usually black in color. Now, what kind of gel that we use? It is the skin part is usually clean for the reference and the ground electrode. The cup of electrodes are filled with gel and are attached for better conductivity. Now, adapters usually are one channel and 2 channel adapters. The test for one eye is usually done by one channel, and those for 2 eyes are usually done by 2 channel adapters. After electrodes, the second important part is the machine. The machine consists of a computer monitor which tells at which stage the investigation we are in. It also guides us through the test, and there are 2 types of stimulation machines. One is the pattern stimulation and another is a flash stimulation. Now this is a side view to show the electrodes that are placed on the child. And this picture shows how one eye is closed for multifocal ERG and the electrodes are placed. The movable chin rest has to be placed in front of the monitor. The chin rest with monitor and the fixation point can be seen in this particular slide. The monitor displays random pattern for multifocal ERG. Then after that, for flash, we move the chin rest is removed to the Ganzl-filled ball. This actually gives us a closer view of baby flash for babies and unconscious patients. Now this is what a Ganzl-filled ball looks like. After the test, the movable chin rest is attached to other place when it is not required. These are this slide shows the different electrode put in different places for in different tests. So recording the ERG, one has to explain to the patient the test procedure. The pupil should be dilated, the patient dark adapted in a dark room with an eye patch, and an electrodes attached with a dim red light in the room, and then we start the test. Attach the electrode and follow the guidelines coming on the computer screen. Safety informations have to be kept in mind. For the machine, a printer or external USB hard drive should be connected via Wi-Fi, and if it gets disconnected, should not be tried to connect while the test is going on. The automatic updates should be deactivated, dark room should be properly lit, and disconnect the power supply before any cleaning or repair. It should not be connected to by an extension cord, and always use an external drive to have a regular backup. A password should be there to protect the patient's data. For the patient, electrodes should not be attached to the damaged skin. The patient should be explained about the procedure, and waste should be disposed in the household waste. Thank you, sir.
Thank you, Dr. Rahul. It was quite comprehensive, and we have learned the basic of the machine and the electrodes. The most commonly used electrodes remains the DLT1.